Bismillah ar-Rahman ar-Rahim. Our lecture today is non-communicable disease or non-infectious disease. Non-communicable disease or non-infectious disease, also known as a chronic disease, tend to be of long duration and are a result of combination of genetic, physiological, environmental, and behavioral factors. The main type of non-communicable disease are cardiovascular disease like heart attack, like stroke, cancers, chronic respiratory disease like COPD, chronic obstructive pulmonary disease, and asthma, and finally, diabetes. Modify risk factors, modifiable behaviors such as tobacco use, physical inactivity, unhealthy diet, and harmful use of alcohol all increase the risk of the non-communicable disease. Following are notes about these risk factors. Tobacco count about 7 million deaths every year, including from the effect of exposure to the second-hand smoke, and is projected to increase markedly over the coming years. 4 million annual deaths have been attributed to excess salt and sodium intake. More than half of 3 million annual deaths attributed to alcohol use are from non-communicable disease, include cancer. 1.6 million deaths annually can be attributed to insufficient physical activity. While metabolic risk factors are contribute to 4 keys metabolic changes that increase the risk of non-communicable. Very important, this very important. Raise blood pressure, overweight, obesity, hyperglycemia, high blood glucose level, and finally hyperlipidemia, increase in the level of fat in blood. In the term of attributed death, the leading metabolic risk factor globally is elevated blood pressure, to which 19% of global deaths are attributed, followed by overweight and obesity and the rise in the blood glucose. Very important, this risk factor, increase in the blood pressure, overweight and obesity, hyperglycemia and hyperlipidemia. What are the socioeconomic impact of the non-communicable disease? Poverty is closely linked with non-communicable disease. The rapid rise in non-communicable disease is predicted to poverty in low-income countries, particularly by increasing household costs associated with the health care. يعتبر الفقر واحد من أهم أسباب الأمراض الغير انتقالية والأمراض المزمنة. Poverty leads to greater risk of being exposed to harm products such as tobacco or unhealthy dietary practice and have limited access to health services. وأيضا يعتبر أنه واحد من أسباب أنه تعرض للدخان، يعني الدخان بكافة أنواعه، وكذلك الطعام الغير صحي وكذلك البعد من أو عدم التمكن من الحصول على الهيلث سيرفيسز، الخدمات الصحية. In low resource settings, healthcare costs for non-communicable quickly drain household resources. The excessive cost of non-communicable disease include often lengthy and expensive treatment and loss of the worker. يعني تعتبر انه لطول فترة المرض فاكيد رح يكون انه طول فترة المرض رح يكون مصاريف العلاج عالية، وكذلك الوركر المشتغلون ايضا يكونون قليلين العمال في هذا المجال. Prevention and control of non-communicable disease. An important way to control non-communicable disease is to focus on reducing the risk factors associated with this disease. Low-cost solutions exist for governments and other stakeholders to reduce the common modifiable risk factors. Monitoring progressive and trend of non-communicable and their risk is important for guideline and guiding policy and priorities. So, to lessen the impact of non-communicable disease on the individuals and society, a comprehensive approach is needed requiring all sectors, include health, finance, transport, education, agriculture, planning, and others, to collaborate to reduce these risks associated with the non-communicable disease and promote interventions to prevent and control them. Investing in better management of non-communicable disease is critical. Management of non-communicable include detecting, screening, and treating these diseases, and providing access to palliative care and people in need, for people in need. High impact as essential non-communicable disease interventions can be delivered through the primary health care approach to strengthening early detection and timely treatment. Evidence shows such interventions are excellent economic investment because if provided early to patients, they can reduce the need for more expensive treatment. Differ from infection disease by the difference between non-communicable disease and communicable disease as the following. This is very important points. First of all, non-communicable. Second, not have defined incubation period. Example, chickenpox have an incubation period 7 to 21 days, while diabetic patient not known when have insulin resistance. Third, multifactorial agents. Example, herpes zoster virus, chickenpox, while diabetic not known agent. History if found not predictable. Fourth, unknown predictable period. So, example, chickenpox have central spread, while with fever, while diabetic multiple symptom present. Boundary between disease and no disease is very blurry. Example, chickenpox patient have or not have disease, while diabetic patient have obesity, metabolic syndrome, impairing fasting, impairing fasting glucose, but hard to say when the point of time patient develop diabetic. Leave disability, so need to rehabilitation, the 6 point, and then 7, slowly progress. Example, leprosy, rapid occur, clinical feature, rapid occur, and cure or death, while diabetic complications slowly appear in blood vessels, nerves, and eyes. Finally, non-reversible and permanent. This is very important point to concern about it. Types of non-communicable اللي هن eyes disease, cardiovascular disease, respiratory disease, endocrine, musculoskeletal, neurology, cancers, accidents. Thank you.